Hi, I'm Dan Liu. I'm going to do the lab application number 2. First, scan my room. Alright. Perform hand hygiene with the alcohol gel. Wear my gloves. Use the alcohol swab to wipe my stethoscope. Alright. Hi, can I check your ID band, please? Thank you. Your name is Dan Smith. The date of birth, the age, so all the information is correct. Now let's start. Hi, I'm Dan Liu. I'm the student nurse. I will do the physical assessment for you today. Is that okay? Thank you. Do you want to go to washroom? No. Do you feel comfortable? Yes. So I draw the curtain, make some private room for you. Now let's start. For your ears, both ears are symmetrical. There is no discharge. And let me palpate the auricle and tragus. Do you feel tenderness? Yes, you have tenderness. Alright, so I will do the whisper test for you. I will put one finger in your opposite ear and then say 3 words to you, okay? Can you repeat the words? 2 red apples? Okay, so the patient can hear the whispered test, the whispered words bilaterally, and then there is no hearing loss. For your nose is on the midline, there is no discharge, no crusting, and let me palpate the frontal sinuses and the maxillary sinuses. Do you feel pain? So no pain, only feel mild pressure, okay? For your nose, first, the lips are symmetrical, the pink in color, there is no swelling, and please open your mouth. I will use the pen light and the tongue depressor to check inside. Okay, so your gums are pink in color, there is no swelling, no bleeding, and your teeth, all the teeth are present, intact, and there is no looseness, okay? For your tongue, the tongue is symmetrical, pink in color. Please lift your tongue. The base of the tongue also is hydrated and there's no lesions, okay? The soft and the hard palate are intact and there's no lesions. Now I'm gonna check your cranial nerve number 9 and number 10, which are glossopharyngeal nerve and vagus nerve. Please say ah. Okay, so the uvula and the soft palate are moving up and back, which means the cranial nerve number 9 and number 10 are intact. Now check your cranial nerve number 12, the hypoglossal nerve. Please stick out your tongue. So the tongue is on the midline. Please move your tongue from side to side so the patient can do this. Please speak the word light, tight, dynamite. Okay, so the patient can say these words without any tremors. The cranial nerve number 12 are intact. Okay, now let's move on to the neck. The color is consistent with the other part of the body. There is no scars, no lesions. Please let me palpate. Do you feel tenderness? So no tenderness, no visible masses, no obvious enlargement of trioid. Let me palpate the carotid arteries. For this side, the rhythm is regular, the grid strength is +2. Okay, for another side. So the rhythm is regular, the grid strength is +2, so the both sides are bilaterally equal. Okay? I will gonna check your cranial nerve number 11, the spinal accessory nerve. Okay? First, I will apply some resistance on your shoulders. Please rotate your head. Thank you. Please shrug your shoulders. Thank you. So the patient can rotate her head, shrug shoulders to resist my resistance. Okay? The cranial nerve number 11 is intact. Now let's move on to the upper extremities. First, the color is consistent with the other part of the body. Both sides are symmetrical. There is no scars and also no deformities. Let me palpate. Do you feel any tenderness? So no tenderness, no masses, no swelling. The temperature is warm to touch. Okay. Please show me your fingers. Okay. So I can see your nail. Your nails are rounded slightly. The nail beds are pink in color. There is no lesions. Okay. So please stand up now and then follow me to do some range of motion. Thank you. First, flex your fingers, extend, flex your wrist, extend, do the radial deviation, okay, ulnar deviation, flex your elbow, extend, and then supination, pronation, shrug your shoulders, abduction, adduction, internal rotation, external rotation. Thank you. Please sit down. Do you feel any pain? Yes, she has pain. She is difficult to do this job. She has the practice and altered range of motion. Alright, now let's move on to your thorax. Please turn it around and lift your shirt so I can see your posterior thorax. Okay, so first the color is matches the other part of the body, and the both sides are symmetrical. There is no scars, no skeletal deformities. The shape is good. Now also the APT ratio is 1 to 2. Now let me palpate. Do you feel any pains? So no pains, no tenderness, no lesions, also no masses. The temperature is warm to touch. Alright. Now I'm gonna auscultate the breath sound. I will use the stethoscope with you. Okay, thank you. So please follow my instruction. Breathe slowly by mouth. Okay, deeply. Okay, inhale, exhale, 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 inhale, exhale. Thank you. So you can let your shirt down. I can hear the rising and cracking on both sides. Both sides are equal. Okay, so now you can turn back, and I'm gonna check your anterior thorax. Okay, so now I'm gonna assess the respiratory rate. Okay, so I will check 30 seconds and times it by 2. Okay, so your respiratory rate is 21 breaths per minute, and the rhythm is not regular. The quality of the respiration is not smooth and with labored breathing. Thank you. I'm done the lab application number 2.